Okay, what we have all come to understand from the literature, from elsewhere, and then the research is that, yes, there have been instances where people have been infected, they have been treated, but at some point, they tested positive again. Now, it's one of two things. One, it could be that indeed this person was actually cleared of the virus, but got himself reinfected.
Okay.
Those areas are grey now and are being researched into.
So it means that
as
when
to
you
whether
recover,
an infection will give you lifelong immunity.
Exactly. That's
or
what I was going to.
What form of immunity it gives you, those bits are still being, because the disease is new with us, technically speaking. We are doing just about 3-4 months. A lot of it was in China. The rest of the world, we are looking at the last 2 to 3 months. So a lot of the detail, we are still working them out. So it's one of two: either there's a relapse, or you were actually cleared properly, everything was fine, and some point in time you got yourself reinfected. Or could it be that even the said negative that cleared you, there was some, in quote, technical error? You know, those bits are still being looked at, but these are smaller numbers, but the research activities are still ongoing. We are documenting a lot of stuff, and it's a worldwide activity. So as we feed in the data and all that, the WHO that is leading this whole exercise is able to come up with very clear explanations and guidelines on these.
Okay, so Richard in Fumbisi has some lamentations about why there was no total lockdown, and it looks like we are waiting for the situation to be boom.
Well, I guess this is a question that technically speaking has to be answered by the state, like he said. But of course, what we have seen clearly is that the state is trying to balance the economic and health implications of what we are going through. But clearly, the priority is on the health side. So as the numbers are going now, like I said earlier, the president in his own wisdom, based on advice, I'm sure will come up with the next set of interventions. But I think we left something out earlier. There was a caller from Nima.
The Nima market.
Yes. In fact, these are the things that are not helping our cause as a country. The social distancing is one of the best ways to contain the disease. Unfortunately, most of our citizens, especially in the market areas, don't seem to either understand or are just being recalcitrant. If you become so defiant and you get sick, what will be the end result for you? God forbid, if you pass, that's it. You can see from what is happening elsewhere. States that have sophisticated health systems are now on their knees.
Exactly.
See what is happening to the United States, see Italy, see Spain, France, even the United Kingdom. So people should not sit back and think that this is far from us. And you can see from our numbers. We started from 1, it is going. I know people who have the entire family, you know, being infected. I know people who have been infected, their friends are also infected. I know people who are just on the streets, they have been infected. We don't know exactly where they picked it from, but clearly they picked it from other contacts around them. So we appeal to the market women and the men in the markets that they should observe these rules. Beyond that, I think it is about time the local authorities also begin to take drastic actions within some of these places. The president in his office cannot do it all.
Okay.
That is why the assemblies or the local authorities also exist. And I expect that they will also go hard on some of the recalcitrant people in their communities to ensure that we are all protected. What we are doing is for our common good. People should not be selfish, wanting to earn more money within the process. Because if you earn money and you lose your life, what will be the worth of it? Yes, go into the market so that as and when people need foodstuffs, they come in and get it and go home. The people going into the market should understand that they also need to observe the social distances. Then those who are selling should also ensure that between themselves the social distancing is there, and then between they and their clients, that is also observed. together with the hand washing and what have you. We should have a lot of these hand washing points in the market. The assemblies should ensure that these are provided. The market women themselves, some have a lot of money. They should help themselves and help protect all of us. We cannot have a situation where some sections don't want to obey the rules, end up putting all of us into that difficult situation where we are all contaminated. It shouldn't be the case at all. And I think the assembly should go hard on some of these people.
Okay.